Morning, everyone. We'll just give colleagues another couple of minutes to join before we get going. Wonderful. Good morning, everybody. It's lovely to see a lot of familiar faces, or names at least, as well as some new participants. Welcome to the third in our series of online seminars on collecting social data in the context of the COVID-19 pandemic. It's really lovely to have so much participation and engagement. We've got three really fascinating presentations lined up for today. We're focusing on panels and trackers, and we're joined by, firstly, Mariette Krokamp from Ask Africa, who's going to be speaking to us a bit about the Ask Africa COVID tracker. We've then got Shirley Jeffries and Bobby Berkowitz presenting from Fenmark Trust, who will be talking to us about their COVID tracker, which is a multi-country study. And then finally, we've got Kim Engel and Tim Brophy from Subgroups at the University of Cape Town, who are going to be talking to us about their experience of implementing the CRAMNIDS survey using CATI with an existing face-to-face panel. I'm looking forward very much to all the presentations, and thanks to all our presenters for making the time and effort to be available to do this. Mariette, can I hand over to you, please?
Yes, thank you very much. Okay, so hi everyone, Mariette here from Ask Africa. Thanks for the introduction. Ask Africa is a locally owned market research company based in Pretoria. And today I'm going to take you through our COVID-19 tracker and the methods and madness behind it all. I'm just going to share my screen with you. Just give me 1 second. Okay, perfect. Okay, I'm sure you can all see my presentation.
Looks great, thank
you. So on the 26th of March, South Africa entered the nationwide 21-day lockdown period. And many people were absolutely distraught at the idea of being locked down for 21 days. Can you imagine? Only 21 days. So 141 represents the total number of days that we've been in lockdown to date. Something few people would have anticipated at the start of this lockdown. Fifth, that is South Africa's COVID-19 world ranking in terms of the total number of cases. And first, obviously South Africa leading the total number of cases on the African continent with more than 500,000 cases to date and more than 10,000 deaths. Globally, this pandemic has revealed the great inequalities that society has produced. The mask unveiled the character lurching below the normality of it all, the things we all got used to. Things like racial and ethnic tensions grabbed the attention of so many during a time of great disruption. And many citizens are calling for reform from their governments and look to leaders for direction during a time of uncertainty. We definitely see that the global citizenry is rising up. The 141 days of lockdown have proved to be tough on South African citizens, businesses, and the government, and widely opened up the inequalities of our own country, forcing leaders to face it head on, things that have been previously overlooked. South Africans are experiencing really high levels of distress, including emotional distress with high levels of depression and anxiety, financial distress, where many are borrowing money for survival, and food security, where 1 in 2 people worry about the amount of food in their homes, and 41% of adults in our study actually reduced portion sizes due to a lack of food and money to procure more. The lockdown is really taking its toll on citizens, with many noticing increased levels of frustration in their communities, up to 70%. These are some of the key findings from our COVID-19 tracker. Now, psychology teaches us that people initially react to danger in one of 3 ways: fight, flight, or freeze, as many of you know. Staying alive is not just a song by the Bee Gees, but also an inherent force that drives human survival. As a research psychologist by profession, it was clear to me that this basic instinct quickly set in when people were faced with this pandemic. For many in the research profession, doing research during this time was seen as madness, a taboo, something that would skew results, interrupt respondents' lives, and many sat and waited for this storm to pass. During the pandemic, the role of public communication, strategies, and education have become increasingly critical to ensure that South Africans are updated on the latest lockdown regulations. preventative measures, and state of COVID-19 in the country to reduce the spread of the virus. As such, Ask Africa decided to embark on an independent study where we wanted to really assess the significant social change that was brought about by this pandemic. We've been measuring the public perception, behavioral change, and the impact that this pandemic has had on South Africans since the start of the lockdown. We really started this project, I think it was end of March, beginning of April. And the aim of our study was really to provide an independent view to businesses, government, NGOs, trusts, and institutions to enable the conversations and to implement strategies for positive change to curb the spread of the virus. So how did we do the research, and how are we doing this research? Well, we basically follow a mixed methods approach for this study to ensure that we unlock insights from various demographic groups in the country in a fast and reliable manner. Our research is conducted using firstly telephonic interviews, or CATI, and also online research. Our telephonic research is conducted from our remote call center, while the online research is conducted making use of a research panel. Subsequent to this, we also decided to do a qualitative view where we asked 10 participants if we could track the live and the impact that this pandemic has had on their lives over a 6-week period. And essentially, we gave them a list of questions that they had to answer, and every day they would do self-recorded videos that they would send through to us. Now, our telephonic interviews are conducted making use of a data frame that contains the details of South Africans who are 18 years and older, as well as their residential and income information. So it contains quite a lot of detail already. The frame consists of about 30 million records with contact details, and it provides a good alternative for face-to-face approaches during this time. From Stats SA's mid-year population estimates, we know that the South African population, 18 and older, includes about 38 million people. Now, the panel interviews, which is the second methodology, are online, is conducted through cell phones, computers, tablets, any electronic device, and it consists of about 40,000 panelists. The CATI and online split is approximately 40-60% respectively. And the sample distribution aligns with the gender, population group, provincial, and age breaks as set out by Stats SA. And we have quotas in place each week to ensure that we reach them as far as possible, to ensure that our results align with the demography of South Africa. So weekly we do between 400 and 600 interviews. And to date, we have reached nearly 9,000 completed interviews. I must say that over this time, we've really been tracking a lot of different themes, and we can see how things have changed week on week. And our results align quite closely with some findings from other research companies that we have been tracking as well. The questionnaire is about 20 minutes, and it's typically administered in English. And I think also just to add to that, we conduct the data collection and quality control in about 3 days of this 7-day period, while we deliver on the results in 1 to 2 days. So typically a full project cycle is completed within 1 week. Now, our omnibus runs weekly, and it measures core topics as well as rotational topics to unpack the public's perception and awareness of topics such as COVID-19 corruption, awareness of vaccines, alcohol and tobacco bans, and school closures. And then obviously some of the things that we keep tracking over time include people's understanding of the pandemic, their fears around the lockdown, emotional distress, food security, financial distress, government and business reputation, trust in the leaders of our country. And then we also started measuring the stages of grief to really understand how people move through the different levels of grief. And we did see that a lot of people are actually still stuck in some of the mid phases. In other words, they can't really progress and move forward past this pandemic. So there's nothing that they're really looking forward to. We can see that they're not really planning for the future yet. They're almost in the state of immobilization. Now, our topics are selected based on core issues raised by government and information shared in the media. So weekly, we do a thorough media monitoring and desk research to plan for the upcoming week's themes, which we then measure in that week's data collection. For the video diaries, as I mentioned, we have preset questions that we shared with the participants on a weekly basis for completion. And these also align with some of the core topics and fractals that we identify for the quantitative component. These people would then provide us with their self-recordings of their experiences. They would share voice notes, photos, so really a rich multimedia experience that we got from that online qualitative engagement. Our survey is typically scripted using a block technique, which allows for easy activation and deactivation of key topics. And during the design of the questionnaire, we include complex triggering to ensure that we have quite a valid study, and also to make sure that we reach the set quotas based on the demographic spread that we want to reach. Okay, in terms of some of the challenges that we experienced during this study, I think firstly, as I mentioned, we really started doing this survey at the commencement of this lockdown. And setting up a remote call center at the start of the lockdown was quite tricky. Our call center was based in Pretoria, and we had to set it up remotely to ensure that we can firstly continue with the work and to ensure that our agents could continue making a living during this time. Now, getting used to a remote workforce was somewhat of a challenge, as you can expect, including things like background noise because people are working from home, load shedding, and aspects like poor connectivity, which we all overcame. Some of these obviously are factors that you cannot maintain or control for, like load shedding, but we have put measures in place to take that into account. Secondly, I think the interview length was also quite a big challenge that we experienced during the study. We found that respondents really need that human connection, and therefore they want to continuously talk and explain their responses to each question posed to them. So we have really high participation ratio, and we can see that people are really glad to share their experiences because they've been in lockdown and isolating some of them for quite some time. Then thirdly, tracking public perception of all the changes during the lockdown becomes quite tricky. It really is a balance of unpacking key themes versus interview length to prevent respondent fatigue, and really identifying the core things that needs to be measured on a weekly basis. And then lastly, sometimes our findings contradict preset hypotheses. So when the alcohol and tobacco ban was implemented, word on the street was that many people were against it, very upset, very pro not having this ban. And then tracking this over many weeks, and when the ban was lifted and reinstated, we found that a large proportion of people are actually for this ban because of high levels of violence that they experience in their communities and in their families. So it was quite contradictory to what a lot of people believe you will find, and then a lot of people question this the findings. But as I mentioned, we have been tracking it for quite some time. Our respondents are unique each week, so we don't include the same participant week on week, and therefore, as I said, we find that some of our results also match quite closely with other research that has been conducted. In terms of some of the innovations and opportunities that we've found from this study was firstly that we could use insights from our target group index study to unpack a pre-COVID-19 view for many of our statistics to provide this comparative view. TGI is a representative household survey that we do twice a year, and it covers 24,000 respondents. And it was really quite nice to see how things have changed from before the lockdown and how people are responding currently. So it's been a really good substantive source of data for us. Then secondly, in terms of innovations, we've really started to use an agile workflow. As I mentioned, delivering a full research cycle within a 1-week period. And as you guys know, researchers, there's a lot of things that go into completing a research project within 1 week. Open-ended answers that need to be coded, reporting, quality control, merging of data sets, and listing of questions for unique weeks, which take quite a lot of time traditionally. Our mixed methodologies were also used in terms of our statistics. We use software like SPSS, Power BI, and even Excel to achieve core things. So firstly, we make sure that key tracking questions are analyzed with standard templates that are set up in the initial stages of the project. Frequencies of new questions are then obviously drawn and further enhanced with thorough significance testing to uncover cohort effects and linear regression techniques, which are strategically applied to unpack and understand influencing factors of burning questions. The online diaries were very successful and have led to the implementation on multiple other projects that provide a really deep immersive experience into the lives of participants and provide, because you conduct it over multiple days, you really establish that sense of rapport with the respondent, and you can see their willingness to participate and engage on a daily basis. So it gives you really rich insights to further substantiate the claims. As I mentioned before, also the base of our survey is self-funded and conducted pro bono. The research has been used as part of the Ministerial Advisory Committee. Our CEO, Andrea, has been serving on this committee and other forums as well. We've also given clients the opportunity to add their own questions to our omnibus on a weekly basis to unpack their core questions, which they then fund. And then lastly, our online portal. So we launched an online portal that contains all of our research, and anyone can access our reports, insights from this link. We found a way to engage with wide audiences to provide facts to further drive investigation, decision-making, and tracking of how this virus is impacting South Africans. And then lastly, you can access some of this information from our COVID-19 portal by using this link. And there you will find, as I mentioned, latest webinars, our latest findings, and information shared by the media. Thank you very much.
Wonderful. Thank you so much, Mariette, for sharing all of that content with us. It's been great to hear a bit more about your work. And goodness, it does sound like a huge amount of work. I think Tara's been capturing questions, which she'll pop up on the screen now. If anyone else still has questions for Mariette, please just pop them into the chat box. There's a couple of questions Tara and I were peppering you with as you went through the presentation. We'd love to hear a little bit more about your sample frame and how you constituted your panel and your CATI sample.
Okay, so our sampling frame is a framework that we obtained from a secondary source. And that frame is really quite comprehensive. So as I mentioned, it contains the details of 30 million South Africans, and we randomly draw from that sample on a weekly basis to make sure that we don't include the same person over and over again. And the panel, we use an existing panel that we tap into just to make sure that we also cover people from different demographic areas in South Africa, and to make sure that we don't just rely on a telephonic approach, but also have an alternative way to engage with respondents just to increase the response rate.
Fantastic, thank you so much. We've also got a question. Hopefully you're seeing them on the presentation now, about what you meant by fractals.
Okay, so in terms of fractals, we just call them a fractal, basically referring to a core theme. So some of the themes that we uncover were things like corruption, people's perceptions of corruption in the country. Other fractals refer to things like the school opening and reopening. We've been measuring things like how people treat themselves when they experience others in the public who don't wear masks. So really behaviors around mask wearing behavior, how people are willing to adapt or change their behaviors if given instruction or given communication from specific sources, like for instance, the World Health Organization or leaders versus traditional leaders or social media influencers as an example. So fractal really just refers to a core theme that we identify that is important during that time period that we really unpack and unlock in more detail.
Do you want to just run through the other questions there, Mariette?
Let me see. Yes, so I think in terms of the third one, how have we been coping to deal with such a long and difficult study? Yes, I do think that you can compare it to actually when you start cycling. I'm a cyclist. So when you start cycling, you are quite unfit and it's really a tedious task. But as you continue exercising, it becomes much easier. And I think we have such a good flow now that we really understand on specific days, we design the questionnaire based on information collected throughout the week. We then have certain days where we program and test the script, do our pilots, conduct the data collection. So we have a really strong project management system, although it does vary sometimes from day to day. And I do think that, yes, in the beginning, it is quite stressful and hectic, but we have a really good rhythm within our team, and we know what the expectations are. So I think we've been managing it quite well. And in terms of over this long period, yes, I think we are entering week 20 already. So it's been quite an intense time. I think it's almost like running a marathon. But the results we get from it is really empowering. And I think just seeing how the work is being used is quite motivating in itself. All right, how will the interview data be used? 9,000 interviews is a lot, will each be transcribed, translated and analyzed. Yes, so the 9,000 interviews, they are not all for our qualitative component. Those are our quantitative questions that we collect through our CATI and online solution. For the qualitative component, yes, we did actually analyze all of that information. And because we had certain themes per day, it was quite easy to extract the information from those 10 respondents we measured over the 6-week period. We basically then combined this information into short video clips and used some of that qualitative insights to substantiate some of the information we found in our quantitative research. In terms of the 9,000 completes, to date, this data is being used by a lot of different sources. As I mentioned, we do make it available for free on our portal, but then if there are additional requests, we have to push that into our team, which then unfortunately comes with additional hours and a cost involved with that. But we do make this available quite widely because we want to see the social change that is being brought about by this, and we want this data to actually make a positive difference in the lives of South Africans by raising core themes and giving voice to citizens. Do panel respondents receive an incentive? Yes, as per any panel, the respondents do receive an incentive, although it's quite a small incentive. I'm not too sure of the amount, but I do know that because they are on an existing panel, which we're tapping into, they do get a small incentive. Okay, question number 6, is the data going to be made available for secondary analysis? We don't upload the data to the portal directly, no, but we have made it available to some people who were interested. So if there is a need, you can contact us. In terms of our response rate on CATI, I don't have the exact figures, but I do remember it was deep in the 80%. So we do get a high response rate on CATI. And that is specifically because we see people really want to share their experiences. They do want to be heard. And I think they do feel that the results are contributing in a positive way. So that's been really great for us. So our sampling frame is really working quite well. And then lastly, do you have any empirical data on the weakness of your realized sample? Quota weighting, assume that responses within undersampled groups were random. Yeah, so we did find that we have some over and under sampling in some of the groups, and we try to correct for that week on week. So as I mentioned, we do have these set quotas, but because we actually complete a full research cycle within a 1 week period, you have to sometimes just over and under sample in some of the quotas. I think, let me just open this up. For instance, within Mpumalanga, we have an undersampling of 1%, and the Northwest undersampling of 2% as an example. So we do have information on this available as well, if it's something that you are interested in. Thank you. I hope I answered all the questions.
Fantastic, Maria. Thank you so much. That was really, really valuable. Colleagues are certainly welcome to add any additional questions to the chat, and I'm sure Mariette will respond to them as she's able to do so. I'd really like to thank you, Mariette, for taking the time to present for us today. And I'm going to hand over to Shirley and Bobby from Fenmark Trust now. Thank you very much.
Thanks. Great. I presume everyone can see my screen. So I'm actually going to start off giving you a little bit of a history and an overview of who Bobby and I are, and actually our history with doing the kind of work that we've actually been doing in the COVID-19 pandemic. We're from an organization called Fenmark Trust, and Fenmark Trust is the financial sector deepening agency for the SADC region. So our mandate is to make financial markets work for the poor by promoting financial inclusion and regional financial integration. So we essentially do this by conducting research to identify systemic constraints that prevent financial markets from reaching those who are excluded, and also by advocating for change based on these research findings. So we're very heavily based in using data and evidence to advocate for financial inclusion and change that includes people into the financial system. So several years ago, Fenmark Trust, in partnership with another organization called Senfree, set up a global resource center that was funded by the Bill and Melinda Gates Foundation and the MasterCard Foundation. And that particular resource center was actually mandated to innovate around the use of and quality of data in the financial inclusion space in order to make decision-making for development better. This really was a global initiative. It went beyond our SADC mandate, and Bobby and I both formed part of that resource center. And our specific team on the research in the resource center was really focused on data collection and new ways of using data. So we really wanted to focus on what were the new things that we could do, how could we leverage data better, and we looked at many different areas, but for myself and Bobby, our strong focus had really been on the development of sustainable demand-side data collection. So what I mean by that is that collecting data at the scale that we want to collect data, we're really looking at collecting data from national audiences. We want to understand the full spectrum of populations. We have a very keen interest in the poor. And that kind of data collection is generally very logistics heavy and therefore very expensive. And what that means is that you can't do it as often. And so it actually makes decision making hard, because in a lot of our markets, people are only collecting, you may have heard of, for example, the Fenmark study in South Africa, it's done annually, but in a lot of other markets across Africa and in SADC, there's only budget to do that kind of a study once every 3 to 5 years. And it really makes decision making quite difficult. So we really wanted to focus on figuring out how do we collect data in a more sustainable way so that we can actually take advantage of new technology to save costs and actually collect data more often, have more useful data that can be used for decision making. So obviously, I mean, globally, online surveys have been a thing for a long time, but for very obvious reasons, online is not really going to work well in the African context. So we really thought the best options to start looking at mobile devices and how we use those. So we worked on a group of sustainable data collection pilots where our main focus was on mobile data collection, and in two ways. The one was using SMS surveys, which is very, very affordable. And the other was using CATI surveys. Now, this is quite a step away from how financial inclusion data has traditionally been collected. We traditionally used probability sampling, which has needed to be in-person surveys. And digital is very affordable and good, but it obviously comes with limitations. So with the SMS survey, I think the quite obvious limitations are that people have to have a mobile phone. That's your first problem. And then also, it's a self-complete survey, so they need to be literate enough to actually participate in the survey. So you have a massive cost saving, but a very likely chance that you're actually excluding those people who are of most interest to us as a financial sector deepening agency, the poor and already excluded. And then telephonic interviews are also very useful in that they overcome the literacy problem. But again, of course, people need to have access to a phone. So we did some pilots a few years ago now, using just SMS surveys to really understand what we could get from them. And they were actually more successful than we had initially anticipated. So we were quite pleased with that. But the kind of key, and I'm sure it's not a big surprise to everyone, the key learning we had there was that there is a portion of the population that is harder to reach, and a mixed method approach would really be ideal. So we actually then set out on a new set of pilots where we tested using mixed methodologies. So we used SMS surveys along with telephonic surveys and face-to-face in-person surveys to create a single sample. But obviously there's lots of issues around that, in that you're using different modes of data collection, and you can do different things with the different modes. So we used a modeling approach to bring all the data together, called multi-level regression and post-stratification. And I am not a statistician, so I'm not going to explain exactly how it works, but essentially the modeling approach that we used, the aim of it is to take into account both your sampling issues as well as the differences in mode. And so the post-stratification really focuses on looking at really small cells within your data. So we're going to multiple levels, that's what it means. So you go to really, really small cells in your data to weight against, and then you can borrow strength from neighboring cells. So what I mean by that is, say you are underrepresented in part of your sample in terms of poor rural women who are age 18 to 25, you can borrow strength from poor rural women who are age 25 to 35 to predict the results that you would get from that cell of respondents. So I won't go into all of the detail on that. If anyone is interested, we can definitely share some research papers with you on how that method works, but I'm going to show you the results of what we did because I think they speak quite well for the method working very well. So what you're seeing here is lots of bars. I'll very briefly explain what each of them mean. And then it kind of shows how well our pilot worked. So the first bar there that says the FII benchmark, so it's a kind of orangey color, that's a nationally representative face-to-face survey that was done in Uganda that we were benchmarking our results against. And then the next column, the sort of darker blue bar, is using SMS surveys on their own. So absolutely no modeling, no weighting, this unweighted SMS data. And I'm sure there's no surprises there that our particular topic of interest was on digital financial services. So I'm sure there's no surprises there that things like active mobile money is significantly higher, and having a bank account, and then also using a digitally stored value account. These are all much higher using just SMS with no modeling. Then our next bar, the light blue bar, is we used the SMS sample and then we applied the multi-level regression and post-stratification model to that. So there's no other data, it's just SMS in this particular one. And you can see that the model does already make quite a big difference, but it's obviously still not enough, which is why it really demonstrates how having that mixed method, having some face-to-face included, is really helpful. So then the next two bars are our use of face-to-face data. The darker gray one, we had only 150 face-to-face surveys, and bearing in mind the SMS sample is 1,000 surveys. So we had 150 SMS surveys included in our sample, and then the light gray bar is using 300 face-to-face surveys. And then if you compare those results to the benchmark, the modeling approach works very, very well to actually bring our results in line with our benchmark. So we're very pleased with those results, and we learned a lot in that, and that really set us up to be able to do some great work in the COVID-19 era. But obviously, we can't do face-to-face surveys at this time. It's just not socially responsible. So that took away our kind of kingpin, adding that small face-to-face sample that you can use to survey with, to model with. So we actually decided for the COVID tracker that we've been working on, which I'll tell you a little bit about now, we decided to use telephonic interviews because we couldn't use that face-to-face data. Although telephonic is quite a bit more expensive than SMS surveys, we do get a broader audience than using SMS. So we decided that because we couldn't use that face-to-face to model against, we wouldn't use SMS, we would actually go with CATI interviews. And just to kind of demonstrate why, and a few things about using this method that are quite positive, our pilots that we did for the mixed methodology were across multiple markets in Africa and Asia. And in that, we had in those surveys, we had a measure on poverty. It's called the PPI, or Poverty Probability Index. And it determines, using a battery of questions, it determines those living above and below the poverty line. based on $2.50 a day being considered the kind of cutoff line. And from our results, you can actually see using both SMS and CATI, we actually do pick up a lot of people who are below the poverty line. So even though we're not going face-to-face and into those places where people living in poverty are, the mobile phones are so prolific that we do actually pick those people up in both of those methods. But then really to just demonstrate why CATI would give us a better sample than an SMS sample in COVID times, I'm just deep diving into Nigeria specifically. You can really see here on specific variables such as women, people living in rural areas, and then very importantly, the low literacy levels. So people who have a lower literacy level, obviously we're much more likely to pick up using CATI than we are using face-to-face. So I think it's just important to bear in mind when using telephonic interviews for in this kind of time, that is essentially the responsible choice for us. But also it's not all bad news in that we have to use telephonic and we can't necessarily get to people who are quite excluded, because actually the data that we've collected shows that those people do show up in our samples. So, but it does mean that we have to be very thoughtful about how we design our surveys, and it's very important to make sure that we actually are designing telephonic surveys to include enough of those people. So they're underrepresented in the surveys. So while in the financial inclusion space, we've always been very focused on probability sampling, when you start using a method like CATI, although you can use random digit dialing to create a probability sample, it's actually going to skew your results to what the telephone ownership universe looks like, as opposed to what you really want to understand. And so we've actually really focused on using quotas to make sure that we are picking up enough people who are more excluded, and then quite complex weighting. And I'm actually going to hand over to Bobby to kind of take you through the kind of technicalities of that approach that we've taken, particularly with regards to the weighting in more detail.
Thanks very much, Shirley. Can everybody hear me okay? Just to check, I don't need to adjust my distance to the computer. So what I'm going to do is I'm going to echo some of the things that Shirley has raised, as well as sort of questions coming through. And I think that it's probably going to spur on more questions, because I probably am just going to give you a sort of very starting point on a sense of what we're talking about. And I'm sure there's going to be deeper, more specific inquiries that people will be interested in. So as Shirley has alluded to, when it comes to working with quotas and not with sample frames, we're talking about non-representative sampling as a starting point, and motivating why quotas are a very good way for going about that. But to take a step back, Shirley's spoken about this post-stratification aspect that's key for doing this kind of work. And the whole thing over here is that if you are working with quotas or whatever the case is, you've got to have a target sense of the population that you're working towards. So because we're working in multiple countries, and because of the quick turnaround time, for managing a study really well, you want to work with a study that's easily standardized across a number of countries, is relatively recent, just so that for the background work that our statistical consultants are doing, there's a much easier workflow and sort of economies of scale on that sense. So in this case, the study that was used is the demographic and household surveys. These are studies that are paid for by USAID. They look at indicators of things like malaria, as well as maternal health and a whole bunch of other things. But they're done relatively frequently, often every 5 years in a lot of countries. They're often done in collaboration with the national statistical offices of those countries. So there's at least, when it comes to their view on what the population looks like, they are quite credible and rigorous, and a good starting point when you are doing this kind of multi-country work, especially doing it very fast. And what's really important with this kind of work is that when you're standardizing things, you want to standardize variables across the different markets for purposes of weighting. They need to be, the benchmark server that you're using, in this case, the DHS, needs to speak to the questions that you put into your survey for that benchmark weighting, and then, of course, be comparable across many different markets. So that's the one thing in terms of the DHS survey. The next thing is that our survey has not just questions asked of individuals, but questions asked of individuals that talk to their household. So a question that will be familiar for many people over here, it's similar to things that get asked in Afrobarometer, is something like, how many days in the past 7 days have you or any member of your household skipped at least one meal? To give a sense, I suppose, of hunger or nutritional limitations. That question is asked of a household. So when you're reporting, it's appropriate to weight that to the household, to the household rather than the individual. So the key point over here is that we've got questions that are asked of individuals, we've got questions that are asked of households. We need to provide for both individual and household weighting. Next slide, please, Shirley. All right, so the next thing that we're then talking about, and Shirley's already mentioned this, is the different approaches to doing surveys and then to doing weighting. So that strange picture on your left is supposed to be an icon that refers to design and design-based weighting, and the one on the right is to refer to model-based weighting. So design-based weighting is what Shirley was alluding to in terms of how a lot of our surveys work, and that's where this is where you have a starting sampling frame, and you're basically saying that I'm going to control for a number of different aspects of the population in order to balance the way that that I interview to get to make it credibly nationally representative. And typically, you know, we talk about enumeration areas, and we talk about stratification variables, things like ensuring that there's appropriate sample by province, and that within province there's control for urban and rural areas, and that you also hear of things like probability proportional to size. So when you're actually going to your areas, the selection is done in a random, sufficiently random way according to these sort of urban and rural stratification aspects, so that you do get decent spread that's well controlled, and also a lot of that control is out of the hands of whoever's designing the survey. The particular enumeration areas that you go to are sort of decided randomly, and when your interviewers go into the area itself, the households that they select, that there's some kind of random way of getting appropriate spread within those areas. So that's what we're sort of used to, where we can actually control things, and we've got a sampling frame. In this case, it's how the population is area spread and how many households are in each of those areas. For coming up with these ways that are reliably random, where we're controlling on our sort of stratification, our explicit stratification, our explicit strata in terms of province and urban rural, but a lot of the other things we don't have to worry about, and you know, there's enough survey statistics in the background, we can be happy to get sufficient spread. That isn't the case with the CADI survey, as people in the comments have and raising questions have made clear. There isn't a sampling frame where we know everybody in the country, what their phone number is, where they live, how old they are, what sex is allocated to each phone number that we might possibly reach, because the whole thing with design-based weighting is that even if not everybody is included, or if they're not included in an equal way, at least we can calculate the probability that they will be selected, and we can take that into account when we then take our sample and we weight it up to the population. That's the whole idea, and it's very difficult to do with telephonic interviewing. There might be countries that have sufficient control where they have these kind of population phone-based registers, but that's not the case in the countries that we're talking about. So we don't have that kind of control. So that's, and this is the case when it comes to sort of doing research in the COVID era. You don't have the sampling frame. So then your other approach is model-based weighting. And I mean, what's quite well known for weight adjustment is an approach called rake weighting, and that's where you basically take your sample and you weight it towards what your population is supposed to look like. But the way that your sample has been sampled is not completely rigorous and controlled and unbiased, as a lot of the sort of questions have come up with. So you are going to have all kinds of errors or sources of bias. But at least if you're trying to get a credible view of the population, it's a way, especially when you're tracking it across several waves of data collection, it's a way to make sure that there's sufficient comparability from one wave to the next. Even if there is quite a lot of noise for the kind of indicators you're working with, it's useful enough. Even when you're doing a design-based weight, you do post-stratification calibration, which can kind of be seen as being akin to a kind of rake-based weighting, in that even when you're taking your design-based weights, your population may look slightly different from what your benchmark, let's say, stats SA-based population is supposed to look like. So you do some slight adjustments to get it to look the same on a number of different variables. That's kind of akin to rake-based weighting, except rake-based weighting takes your sample and just does that sort of calibration adjustment. All right, so next slide. Okay, so I mentioned that we've got both individual-based weights as well as household-based weights, and there are several of these things that are in the DHS survey in terms of our benchmark population distribution that we use to adjust on. So for both individual and household, we look at region, we look at urban rural, we look at the main language that's spoken in the household. We look at certain key household assets, and it depends by country. It could be the main kind of toilet being used, whether there's sort of electricity, whether there's television ownership, depending on what seemed to differentiate in a useful way for each of the countries. On the household, we also look at the number of children in the house, the household size, the number of elderly in the house, and on the individual weights, we look at gender, we look at age, we look at education. In South Africa, we also looked at the racial group too. So that just gives a sense of what's actually going into this adjustment. Next slide, please. So these are some key concepts just when it actually comes to doing a rake-based weighting, and it's quite useful for thinking about these things in terms of the fact that you've got these sources of bias going on in the background, and just for how to think about working with that bias and towards whatever our focus population looks like. So the first thing when it comes to rake weighting is trimming, and this is the idea that obviously, let's say we've got a sample of 1,000 people, and when we weight it, our population is controlled to also look like a sample of 1,000 people. If our sample itself was very well managed and very close, then our weights on average are going to be 1-to-1. We've sufficiently controlled for all these different kinds of demographics, so we don't have any sort of biases in our actual sample compared to what we're looking for. But often the case is, as she sort of illustrated, intimated, that they're going to be potentially poor rural women, or people with low literacy, or people without phone access that are underrepresented. And so a lot of the people in our sample, or some of the people, could, when it comes to weighting, actually have a far greater role to play. And the idea of trimming is basically to say that there's got to be a level at which people can't, a cutoff for how many people get represented. Okay, so trimming is basically to set a top line to that. The next thing has to do with bias variance trade-off, and this is the idea that when you start to weight quite a lot, you introduce variance in terms of your estimates. But on the other hand, you've got your population distribution that you're focused on, and the extent to which you don't respect that distribution creates bias in terms of your actual estimates. So there's a bias variance trade-off between limiting your weights and limiting your variance, or maximizing your weights and minimizing your bias towards your population focus. And then there's the design effect, which basically summarizes the influence on unequal weighting of the uncertainty in the resulting estimates. And that basically means that when you've got a sample, there's always a estimation interval around that sample. When you then weight that sample, you expand on that on those estimation that estimation interval, and that's your design effect. And when you're not someone like Mariette, who's actually embedded in the organization doing the actual data collection, these kinds of things, particularly design effect, are very useful for as diagnostics to monitor how well the sample is being managed by whoever's doing your data collection. So these just are very useful things to use. Next slide. And this is just an illustration of what's of this, and particularly the sort of design effect. So here we've got some of the countries that we've gone to. We've got the different waves. We've then seen if education is being recoded. And what this means is that the lowest education, which is linked to sort of literacy, the lowest level of education, which in our case would be primary school or less, it's much harder to get people via that on the telephone. And sometimes we haven't got enough, where we've had to merge this education category with the education category above it. If it's true in that column, we've had to do a merge, because if you look at the next column, we just didn't have sufficient people in this lowest education compared to the DHS distribution of the population to then use the sample as it was in a stable way, and we had to sort of merge it with the next one. The second last column, individual weight max, shows you that trimming, at what point weights have been trimmed. And then the design effect basically shows you for each of these countries, for each wave, what that design effect looked like. So you can see a country like Uganda has very high design effects for wave 1 and wave 2, and that just means that we needed to push for much tighter sample control by our service provider. So you can see how these diagnostics are retrospective, but they help with the prospective work. And it doesn't mean that once you've brought your design effect down, it's going to continue being brought down. You really have to work hard on pushing the quota management from your data collection, and that's something that Mariette alluded to in her presentation. Next slide. So this is just an example of where where these kinds of design effects and sample management comes out. And here, this is Uganda, and what you can see over here, when you actually go down into a particular question, and then in that question and the answer options in that question, you go down in terms of subgroups, and that's something that's been asked as well. When you've got large design effects, the data is really unstable. So what you can see is wave 2 is particularly unstable, and particularly wave 2 women. So something like the proportion of women that said that they were not making money in the sample was 39% in wave 2. But when we actually weight that according to all different things, that gets weighted down to 19%. And so it just means when you're then going down, especially with a small sample, a relatively small sample of 1,000, when you're then going down for subgroup analysis, when you've got large design effects, you can't, you have to exercise caution in how much you can analyze by. And it shows you the limits when your sample is very, when your actual sample is very different from your targeted population. And I think, I'm not going to, I know we really are pushing on time and I've spoken too long, but this is just a good example of how keeping your diagnostics close is really important, especially when you are doing non-representative quota-based sampling. Next slide. So this is sort of just very much summarizing some of these key points. You can get biased estimates of outcomes among subgroups with something like raking. Your uncertainty estimates, this is something else, and this is sort of related to MRP. Raking doesn't take into account the uncertainty in the sample. It basically takes a sample as given. But if you've got a more sophisticated technique like multi-level regression and post-stratification, you can actually take that into account when it comes to your estimation intervals. It's just something else that you can control. This thing about different population base, so a big source of our design effect in a country like Uganda is that the phone ownership of adults in Uganda is something like 60%, whereas in a country like Kenya and South Africa, it's closer to 90 to 95%. And so, especially when you're doing a tracking survey of indicators, it could be better to pick a different population base, in this case, mobile phone owners, rather than expanding your sample to the total population where there's sort of a mismatch in phone ownership. And then other modeling approaches, I've mentioned MRP. This was just an example of rake weighting, which is easier to work with and understand, especially when people are working with the raw data, and a lot of our audience has access to the raw data and works with it. But and there are limitations when you're doing modeling in terms of other work that you can subsequently do econometrically. Your indicators are your outputs, and so you're effectively doing the fancy stats to deliver your indicators, but there's a limitation in terms of subsequent work you can do with that. I'm going to pass back to Shirley and apologize for taking up so much of it.
Thanks, Bobby. No problem. I'll just take 2 more minutes to kind of wrap us up, and then we can move on to some questions. So just as bringing us back to the actual study itself, we've been doing our COVID tracker in 7 markets in Africa. So that's Ghana, Nigeria, Kenya, Rwanda, South Africa, Uganda, and Zambia. And we did this study, we went in the beginning of April, if I recall correctly. And it was very, there's a strong push to get data out as quickly as possible, because South Africa, not so much, but in the other markets that we went into on this, there's a real data vacuum. There's not a lot of information that comes out, and there's a real hunger for data. From development agencies across the world, from within the markets themselves, and then also from our funder. And I mentioned earlier that we are the financial sector deepening agency for SADC, but on this particular work, we've really partnered with the other financial sector deepening agencies in Africa. We are part of a network with them, and we do collaborate a lot. And it's been a real really beneficial to have them alongside us to help us get the work contextually right. But we also learned a lot of interesting things along the way, and I'll very briefly share some of those just to help if anyone's thinking of implementing this kind of work themselves. As I mentioned, there's this real hunger for data, and across the continent, and we're also being funded by development agencies. And currently, well, we're being funded by big global funders who currently, actually, a lot of their funding is not going into research, but or not going into demand-side survey data research, but more into researching things like a vaccine for COVID-19. So the budget was pretty tight, so we wanted to be cheap. We also really wanted to get that data out as quickly as possible so that it could really help governments and civil society in each market to quickly make decisions about how to implement lockdowns, how to mitigate as much economic impact as possible. But then obviously we want it to be good. And there's a kind of saying that you can have two of those things, you know, fast, cheap, and good, pick two. And we tried very hard to make all three work, but obviously, as you've seen, we've had to do some diagnostics as we've gone to try and improve over time, and we certainly have seen improvements over time, but it also does need to be something that's followed quite strictly. But really, for me, like the key finding that I would take out of this, and I'm sure in hindsight is 2020, but we really pushed up front to get this work into field really, really quickly. And that actually led to quite a few logistical challenges for us that were not foreseen. So as an example, if we'd put a bit more time up front, we could have used a single survey script for all 8 countries and had something that would produce consistent variables coming out from every country. But we didn't. We rushed to get in as fast as we could, and the fastest way to do that was actually to go into different markets sooner and to stagger the going in. And what that meant was we had a separate survey script for each market. So then there'll be small frustrating things, and I know it sounds a little bit pedantic, but there'll be something where the labeling on a variable will be different in South Africa as to what it is in Kenya. And what that means is that every step in the process that we're trying to automate actually is not automated. So I think those kinds of things were really key learnings for us. I think my biggest takeout, if I was to do this again, is I would push back harder to say, let's take an extra week up front and actually do this a little bit more have a firmer foundation, so it would not have been quite as fast. And then in addition to that, because we've been trying to churn out the results really quickly and getting them to people as close to real time as possible, there's also been places where our quality control checks have actually only come up a little bit later in the process than it would be ideal. So for example, you might notice in analysis that there's a very strange outlier, as opposed to having picked that up in an additional and in a sort of normal QC process. So we've obviously learned as we've been going along, and we've been adding steps in along the way. But I think there's just those kinds of key learnings that, although fast, good, and cheap can be possible, maybe, I think just a little bit of slowing, what's that expression, more haste and less speed, or yeah, would have been a much more stronger footing for us going into this. And then just another interesting challenge that we've had, because we staggered the approach and there's a lot of interest for cross-country analysis in this, it's very hard to say how do you actually compare the different markets, because we weren't necessarily in field at the same time in each market. And then there's also lots of different kind of contextual things that are quite challenging. So lockdowns are at different times, the infection rate is at different paces. So there's been a lot of interest in doing cross-country analysis, but our view really is that the best way to analyze and work with this data is to understand it in the context of the market that it's in. And if you're going to be comparing across markets, our data across markets, you really want to be looking at the context in the different markets. So South Africa's lockdowns have been different to other markets, as an example. The way that our data, the results we get from our data, also obviously impacted by the level of lockdown and what that means for people. So we really need to understand that. And then just very, very quickly, some talking about, we've talked about some of the challenges that we've had across this study, but there is, just to look at some of our data very quickly coming out of South Africa, we saw our results coming out showing that from our second wave of data collection to our third wave of data collection, there was a reduction in income, and that this disproportionately was affecting women. And then I'm going to make a little nod to our next speakers in the NIDS-CRAM survey. That data is actually validated by work that they've done as well. So I think there is, fortunately for us in South Africa especially, there are other sources that we can validate against, and those are quite promising, showing that even though it hasn't been perfectly smooth and not everything has gone exactly how we would have liked it to, we can still validate our data against other data sources, which is good news. And then if you are interested in our data, it is actually freely available as well. We also have a portal, and it's that COVID-19 tracker.africa. And all of the data is available for download. And we also have an interactive dashboard there where you can view our results as well. So yeah, so that's us.
Fantastic. Thank you so much, Shirley and Bobby. That was really, really fascinating, and certainly I think has opened my eyes a bit more around the issues of weighting and how to manage that for different samples. In the interests of time, I think we're going to move straight on to the next presentation, if that's okay. If we have a little bit of time at the end, we'll come back to the Fenmark Trust team to respond to some of the questions. Otherwise, we'll circulate responses after the seminar. Thank you very much again to Shirley and Bobby, and welcome to Kim and Tim. Thank you.
Good morning. Thank you very much for having us. My name is Tim Brophy, and along with my colleague Kim Ingle, we are from the Southern African Labour and Development Research Unit based out of UCT. And we're here today to talk about our experience with re-engaging with an existing face-to-face panel via CATI in a rapid response survey. Kim has very kindly offered to deal with the slides for me, so we'll go slide by slide. All right, so how we're going to take this journey today is we're going to have a look at NIDS and NIDS-CRAM, how they compare to each other, the overall timeline, sampling, re-engaging with the panel, tools and checks that we used, and where we're going to next. Slide. So what is NIDS? NIDS is a survey that was historically run by Soldru at UCT. It was a government initiative, and it's there to study the well-beings of South Africans and their households and to see how these change over time. Originally, it was a resource to support evidence-based policymaking and to monitor the current policy implementation. NIDS started in 2008 with our first wave consisting of 400 PSUs, which is about 28,000 respondents in 7,300 households. The Wave 1 respondents became known as our continuing sample members, or our CSMs, and these are the respondents that we followed each subsequent wave. In subsequent waves, we also interviewed co-resident household members of these CSMs, and in 2017, we did a top-up to maintain representativity. In Wave 5, we managed to successfully interview just less than 40,000 people, which occurred in 2017. As I mentioned, we tracked the same people, but in order to try and maintain the sample size, we also track any children born to our female CSMs, just to keep it balanced. As I mentioned, NIDS is a panel study, with our first wave occurring in 2008 and our most recent wave, Wave 5, occurring in 2017. It's a nationally representative sample and allows for us to track the changes of South Africans' lives over time. Slide. So this brings us to NIDS-CRAM. So what is NIDS-CRAM? It stands for the National Income Dynamics Study Coronavirus Rapid Mobile Survey, and is part of a broader study called CRAM. It's a special follow-up study of randomly selected respondents from households who were successfully interviewed in NIDS Wave 5, which occurred in 2017. The purpose of the study is to investigate the socio-economic impact of the national lockdown as it relates to the state of disaster, which was introduced by government as a result of the COVID-19 pandemic. Now, when we were deciding on NIDS-CRAM and the best method for NIDS-CRAM, we looked at different modes and tried to figure out what would be the most appropriate mode given the national lockdown. Eventually, it was decided that a telephonic interview gave us the best chance of getting a representative sample given the constraints of a lockdown. So that is the mode we chose. The purpose of the study is initially to address the gap in information for traditional surveys, as it became evident that traditional surveys were also grappling with how to conduct research under COVID and lockdown. And so there was a gap in the market that needed to be addressed in order to understand how COVID was impacting South Africa. We have a broadly representative sample. The purpose of the study is also to collect and release data as quickly as possible in order to provide policymakers with relevant data. And this also allows us to see changes over time and also to see how COVID-19 is impacting your everyday South African. Slide. So how does NIDS-CRAM compare to NIDS? Well, very simply, it comes down to mode. Traditionally with NIDS, we were conducting a face-to-face survey, and this gave us a lot more time with the respondents. We were conducting a household interview as well as individual interviews for all of the respondents that lived in the household. This being adults, proxies, and children, and proxy interviews were conducted for respondents that were not there at the time of the interview. All of these interviews ranged between 15 and 45 minutes, which meant we had a lot of face time with our respondents, and that gave us the opportunity to not only ask a broad range of topics, but ask each of those topics very in-depthly. However, when we were discussing with colleagues that conduct telephonic surveys, we were advised that after about 20 minutes, most respondents start to lose interest, and then any responses start to wane. The 20 minutes became the magic number for us. Any survey we were going to do had to be conducted within that 20-minute time frame in order to keep our respondents interested in the survey. So with that 20-minute limitation, obviously came the ability that we weren't able to ask as many questions as we would traditionally like to do. However, I think in that 20 minutes, we were still able to ask a very varied group of topics and to ask enough detail in each of those topics to have some meaningful results. I think we've used those 20 minutes very wisely and very well. The benefit of using NIDS in this context is that we also have an existing relationship. These respondents have been part of NIDS since 2008, so for over a decade, and we've been able to maintain this relationship with them. They're as much our family as anybody else is, and we really do have the pleasure in continuing to tell their story even through this pandemic. I'm going to hand over now to my colleague, Kim.
Hi everyone. Slides. Cool. So just a overview of who all is involved in this NIDS-CRAM study. It's a really big collaborative effort and has got a number of principal investigators, which represent 3 universities in South Africa. Then look at the broader CRAM team. It involves over 30 researchers in total who represent 6 South African universities, so Stellenbosch University, UCT, WITS, UJ, UWC, and Rhodes. Ethics approval for the study was obtained from UCT, and reciprocal ethics approval was obtained by us from Stellenbosch University. So to give you an idea of how this whole journey started for us, it started back in March 2020 when Dr. Nick Spall, who's at RECEP at the Stellenbosch University, first conceptualized the study, realizing that the COVID pandemic and the associated lockdowns were going to have a really profound impact on society. Then found funding, started working groups, a reference group, and a steering committee. In thinking about the study, it was at the stage when eventually the sampling team realized that it would be well, I'll explain in further detail later, but it would be beneficial to use an existing sampling frame, and as a result, the NIDS sampling frame was decided to be used. As a result of NIDS being used, and that Soldry had historically implemented NIDS, Soldry was commissioned to be the implementing agent of the study. There was a questionnaire which the working groups had all contributed towards, That was finalized in April, and translations were completed on that questionnaire. A sampling methodology using the NID sample was determined, and a very short pre-test or pilot was done at the end of April. Then in May, on the 7th of May, we started Wave 1 data collection. The paper topics for the Wave 1 data and the authors thereof were finalized. And the aim was to release the data as soon as possible, but when the data was released, also release research as well. So all throughout the cycle, there was intense time pressure. It was initially envisaged that hopefully data collection could be done in May, but due to a lot of complications with the sampling methodology and how that could be implemented, we ended up extending it through to June. So data collection carried on in June. On the 6th of June, we were still in field, but we had an internal alpha release to paper authors so they could start working on their research, because as I said, the research was going to be released at the same time as the data. So we wanted to allow them to start working on their analysis. On the 15th of June, a beta data release was sent to paper authors, and that was on still preliminary data, which was still being collected at the time, but a slightly bigger sample than the alpha release. Then on the 27th of June, we finished data collection, and then had a frantic few days of data quality checks and working with our service provider to get everything finished off. And on the 30th of June, we released the final data internally to paper authors together with final documentation of the data. So there was quite a push in those 3 days. We got it done. And then in the meantime, the authors were working on their papers. We sent the data and the documentation to Data First so they could prepare for the public release. Then the research papers were finalized, and on the 15th of July, the data was released at the same time as a launch, which was held via Zoom, and the research results were discussed in that launch and have since been discussed with multiple different NGOs and government departments by the broader CRAM team, who I should mention, I see a number of them are on this call, so hi to everyone. Then at the end of all this, where did Wave 1 end up and by when? So as I said, we did the fieldwork between the 7th of May and the 27th of June. In that time, we managed to speak to 7,073 people. And this data has been quite well used, it seems. As of the 12th of August, so last night, we took a look and we saw what the downloads were on Data First, and there were 4,595 downloads. So yeah, I was hoping that people will use this data. It is freely available on Data First's online data portal. So anyone who is interested, please do take a look, download the data and read the accompanying documentation, because we've tried to help researchers through that documentation as well. So a little bit of an explanation about why NIDS was used and the benefits thereof for this study. So the benefit of using an existing panel comes down to what a lot of people have discussed this morning already, and that's we couldn't do an in-person survey like would normally be done, and that meant that it was either going to be SMS, online, or phone survey, and as Tim mentioned, the decision was made to go for CATI, so phone survey. But then the challenge is to find a sample that is representative to draw from, and then somehow being able to correct for those people who are either not answering their phones or don't have mobile phones. So the benefit of using NIDS is that it's a very well understood and well utilized data set, and it allows for the sampling team to see which people were taking part and which ones didn't, of those who were sampled. And this allowed for adjustment for non-response with weights. The subsample from NIDS Wave 5 consisted of those that were aged 18 and above in March 2020, which is when the study was being organized in the beginning. This sample was then stratified and sampling took place within these strata. the sampling team sent us the operations or implementation team these batches of the sample, was at 2,500 at a time. And then we prepared the listing, sent that on to the service provider, and then they would try and interview people within those within those batches. The design of this is that the sampling team can see the response rates within strata of the batch and then correct in the following batch to try and achieve the sampling rate that they wanted overall. So by doing it in a batched approach, it allows for adjusted sampling rates within strata in later batches, given the performance of earlier batches within those strata. So this is for a sampling methodology allowed for that adjustment, but from an implementation point of view, this ended up being quite challenging because we have quite a few phone numbers for people, so we needed to close off batches one at a time in order to give the feedback to the sampling team who could react and then adjust the sampling rates going forward. In the end, we achieved a 40% response rate overall. And this is pretty high for a phone survey. And it's also relevant to note that the phone numbers that we were using to try and get a hold of people were 3 years old, because people were last interviewed by NIDS in 2017. So in doing this study, we faced a number of challenges, like a lot of people will at this time. And our biggest challenge, as the previous speaker was talking about already, was time. And there was this desire to get the data out as quickly as possible so that researchers and policymakers could see what the situation was and react accordingly. But this time obviously placed a lot of restrictions on what we could get done and how difficult it was to get things done. It meant that we had to have a very, very short pre-test, which meant we had to do a lot of the learning on the go and a lot of building systems on the go. The questionnaire, as Tim mentioned, had to be around 20 minutes in length. And the version that was pre-test we found was a lot longer. So we had to significantly shorten the questionnaire after the pre-test. There were very late changes made to the questionnaire, and some of these were driven by the announcement of the COVID-19 grant, for example, because this survey wanted to see what the effect of policy and the lockdown was on people in South Africa. The questionnaire was contributed to by a number of different people in working groups, but then we needed to turn it into an operational questionnaire for the pretest in a very short amount of time. Between pretest and main study, we discovered that we needed to add more detailed introductions for the interviewers who were dealing with the respondents over the phone, because they had not dealt with a sample before. So depending on the type of phone number that they were phoning, the agent was given a different introduction to speak to people and try and explain who they were looking for. Because we had a number of different phone numbers, there's no guarantee, and these phone numbers were from 2017, and a lot of people within households share phone numbers, there's no guarantee that the phone number that you dial will be the person that we're trying to get a hold of. So those introductions tried to guide the agents in having this discussion with people and not getting confused about who they were talking about. An important thing for us personally was that this was a telephone survey. So this was something new for us. We've dealt with fieldwork surveys. Within Soldru, though, the JPOL Africa have done a number of telephone surveys. So we found within Soldru, we spoke to colleagues in JPOL Africa, and they very kindly shared their insights from previous phone surveys, which helped inform us how we handled this study. The training, obviously because of lockdown, had to be very, had to be via Zoom. Because of this medium, it meant that it was a lot shorter than what we were used to. So that was a challenge as well. And then, as I mentioned before, we have multiple phone numbers per respondent. These phone numbers were from 2017. And because this is a panel, we have to allow for time for tracking. So these phone numbers, we're trying to get a hold of these people through phone numbers. We're not trying to just phone numbers. The focus is on the people. So phoning a number may result in someone saying, oh, I don't know this person, here's their new, or another phone call may result in, well, here's the person's new phone number, why don't you try that one? So it can be multiple phone numbers that people need to work through in order to get a hold of someone, but also multiple tries on these phone numbers. And that combined with the batched approach to sampling just means that it was all a little bit challenging in the end. But it's important to note that there were lots of people involved with the study, and a really great broader team from CRAM and our service provider, our relationship with Data First, and there was a translation service provider with which members of the team had worked with before. The sampling team also had dealt with surveys before, and some of them were familiar with NIDS. So altogether, different groups of people had overlapping experience, but no one group that was involved had quite dealt with a study like this before. But fortunately, amongst everyone that was involved, we covered the translations, having dealt with phone surveys in the past, having dealt with survey implementation, panel survey implementation in particular, and then publication of the data through Data First. And I add that in as well because, as I mentioned, we had a very short turnaround time from final data collection to publishing the data on Data First. And we had a relationship with them before from dealing with publishing the NIDS data. So we knew what they needed. They were familiar with the data set. So all of these relationships within managed meant that we managed to get this all done in the amount of time that we did. So being a panel, we needed to, and an existing panel, we needed to re-engage with these people, but we were engaging with them via a different medium, and it was 3 years later. So I asked one of my colleagues, Nobu, who's an experienced survey assistant from NIDS. She's worked their way from the beginning in 2008. And she helped me out with the training and spoke to the agents about her experience of dealing with NIDS respondents over the years. And I think that was quite useful to try and explain how NIDS and the survey assistants and our field workers built up a relationship of trust with our respondents, how our survey assistants introduce themselves and get respondents to speak to them. And this also informed the way that we did the introductions over at the beginning of the questionnaire, which we put in more detail in between the pretest and the main study. But in both the pretest and the main study, from this experience, we were informed that it was useful to both mention the person's name and surname. And also in NIDS, in the later waves, we were collecting alternative names. So that's like someone's nickname, for example, and their age. And this can be quite useful because a lot of people in the same household sometimes will have very similar names. They might be family names, and the age can help distinguish between that, and so can the alternative name or the nickname. Then on phone numbers, we had, as I mentioned, multiple types of phone numbers per respondent. And this could have been their own phone number that they gave us, their alternatives, people that they lived with in the past. So we had a multitude of different phone numbers, but this also required that there were a number of phone numbers to try, and we needed to come up with some sort of criteria for people to be phoned a minimum amount of times in order to qualify as uncontactable. We also sent an SMS to their primary phone number in advance so that they're aware of the study. We had a short introduction at the beginning of the questionnaire to explain the mode change and what the study was about. And in the following waves that was all for wave one and applies for the waves going forward. But in the following waves, we will need to have a specific focus on relationship management. I'm just going to hand back to Tim now.
Thanks very much. So as Kim mentioned, we were doing this really quickly. So we were able to leverage tools from NIDS that we've been developing over the last decade as part of the implementation for NIDS CRAM. So part of those tools were scripts that we'd already developed for CATI/CAPI raw data conversion, our skip pattern checking. This is an algorithm that allows us to check all possible permutations of a respondent's path through the questionnaire to ensure that no questions have been skipped or missed. We also have a valid range check, so we predetermine our valid ranges, both for continuous and categorical values, and the valid range report will generate any violations of those. This helps us identify both outlier values, but just anything where potentially there's been a conversion issue or there's been a data quality cleaning issue, anything like that. It helps us hone in on those. But most importantly, in the context of a panel, we have something called the wrong person check. Now, this is a check that we run. It's an indexed check against certain demographic features, as well as some education and other features of the respondent that we've obviously been collecting data on these respondents for over 10 years. So we've got quite a lot of information on them. For any new data that comes in, we check that against the known data and determine whether or not we believe that this is the correct respondent, that the correct person has been contacted. Where we have any doubt that the incorrect, or where we have any doubt that the correct person has been contacted, we pass that back to our service provider, who then listens to the calls, double checks that there wasn't a capturing error, and potentially places a call for confirmation as well, and then will report back to us either that it was in fact the wrong person, in which case we disregard that interview, or they will give us any data corrections that are necessary based off listening to the calls themselves. We also then use some of our geographic matching tools, our fuzzy string matching for the occupation codes, and to generate our occupation codes based off the occupation descriptions that are given to us, our anonymization tools, and all of our derived scripts as well. Now, those are the tools we were able to bring over from NIDS, but then the tools that we had to develop specifically for CRAM, and Kim alluded to the fact that we were developing scripts and processes while data collection was happening. One of those was the pre-population. This was to support the responsive sampling methodology that Kim's spoken about. The live data collection dashboard. As you can see, we've been working with a lot of collaborators from different parts of the country. So we had a live dashboard to support data collection, to allow everybody to see the progress of data collection and keep us all on track. We also did daily dataset generation for the sampling team so that they could adjust the sample for non-response as they needed to. We also implemented fieldwork company data quality fixes, so the fieldwork company were conducting their own data quality checks on the back end, and any fixes that they had that they wanted to feed back into the data, they were sending to us. So we worked with them to develop a process to allow us to do that very quickly and very accurately. And then just any basic reporting back to the fieldwork company to keep the fieldwork company and ourselves on the same page. All of this, to say, wouldn't have been possible without the support of the data quality analysts. We really had an amazing group of people who were staying up at ridiculous hours of the morning to get this done as quickly as we managed to. Slide. So where to next? We are going to continue to tell people's stories. Wave 2 calls have just recently been completed, and the data cleaning and data production has begun, and we hope to have some data out relatively shortly. The plan currently is for 5 waves, at least until the end of 2020. Slide. Thank you very much from both Kim and I.
Wonderful. Thank you so much for sharing some of your experiences and your approaches to implementing the survey. We've just had a couple of questions, most of them from my side. So I'm not sure if you'd like to respond briefly to any of those, and then I will hand over to Tara to wrap things up for us.
Cool.
Tara, do you want to, we're on the Fenmark questions at the moment.
Right, so we haven't had a chance. So let's, yes. So can we hear from Saldra, and then we do need to go back to the Fenmark questions as well, and then we'll wrap up for everyone. Thanks.
Sure. I'm happy to answer about the alpha and the beta. So effectively, in the context of NIDS CRAM, and given the time frame that we had, we chose to do an alpha and a beta release of the data. These are very internal releases, the idea of an alpha release in this context was to basically give the broader CRAM team a preview of what the data structure looked like, what the variable names were looking like, just to get them familiar with the data set structure itself, in order to aid them in number one, writing papers, but also just getting an understanding of the responses that were coming in. The beta release went to a broader group. Those were for the paper authors. And that was similarly to give the paper authors time to have a look at the data set, to start their coding process, certainly given the timeframes we were trying to accomplish, both analysis and papers being written and data collection. It was just a tool to allow them to start really coding and trying to work out their methods. Right, question number 2.
Yeah, I'll answer the second one.
Cool.
So on the response rate that I'm referring to is, of the people who were sampled, how many did we get, what proportion did we get successful interviews for? So we got 7,073, and that was over, I think in the end, I think it was 17,500 that we ended up trying at the end. And that was because we had this batched approach of batches of 2,500 at a time. And the way that I think that something very important to know about this is that we had a very limited amount of time. So we had a minimum call criteria for our service provider in order to qualify someone as uncontactable and then being able to close them off. And we needed to have some sort of criteria so that they could close off batches, rather than keeping on trying to phone people for the whole time that we were in field, because the sampling team needed to see how the performance of a batch was doing in order to correct for that in the next batch, and then oversample groups that were underperforming in previous batches. So it's relevant to know that of this 40%, of the 60% that were not successfully interviewed, the vast majority are what we termed as uncontactable. So we had multiple phone numbers for people in some cases, but we didn't necessarily have their personal phone number. It may have been people that they lived with. We might have only had one phone number for an alternative contact. And these details were from 2017. Because it was a field study, we previously had GPS coordinates and addresses, so we could physically go to people's dwellings and try and find them. We did have comprehensive contact information, but we didn't have that benefit of going into field and actually trying to track down people in person. So I think that's quite an important part of why our response rate was 40%, is the largest chunk were people that we just weren't able to get a hold of within the period of time that we had. Maybe if we had had longer and we had carried on phoning longer, maybe we could have increased that rate, but just practically that's how it ended up. And I can't speak to Ask Africa's 80%. I don't know how that was defined. It may be that they have more recent phone numbers. Maybe it's a sampling frame where everyone has their own personal phone number. But yeah, if you are interested in the response rates, breaking down a little bit more, please have a look at the technical paper on sampling in NIDS-CRAM. Cool.
Thank you, Kim and Timothy. I do have a question for everyone, but let's first go back to the Fenmark team, because there were questions there that we didn't have a chance to get to at the end of their presentation. It would be great if we could keep it fairly short, because I don't know if there are other participants on the line. Please do continue putting questions into the chat. All right, can I hand it back to Shirley and Bobby?
Sure. I'll just kind of go along, and then Bobby can jump in on things that yeah. So the first question in terms of questionnaire length by different modes, it's an interesting question. We obviously face-to-face, you can go with a longer survey because people are a lot more uncomfortable telling someone to go away when they're in front of them. Whereas SMS, particularly if someone gets bored of a survey, they can very easily just put their phone back in their pocket. So you have to make sure your surveys are very short and engaging. What I would recommend if you're doing a mixed mode survey is to actually try and keep your survey the same across modes, or at least make sure that your first part of your survey, if you're going to be adding extra questions for in-depth analysis onto the face-to-face survey, first make your upfront portion of your survey actually the same as what your SMS survey is, so that it's easier to actually bring them together. Then the question on variances, I think I'll give that to Bobby because he's a little bit closer to that than I am.
Yeah, I mean, to be honest, we haven't looked that closely at it, but I think that design effect example gave a good example. I mean, the design effect, I think, summarizes it quite well. Like, definitely across countries, definitely across waves, and that's a very useful diagnostic to get a sense of that. And then you have to do that kind of comparison of unweighted, weighted data by broken down by questions of interest and subgroups of interest to really see how it works out. But again, what's interesting comparing us to sort of the NIDS cram guys that just came through is that there's when you're controlling for your ideal sample and what you're going towards, and not as much of the sort of other kinds of variation in randomness, where you can hear NIDS, this was a very strong focus at a respondent level, then you're only looking at an overall subgroup level, and you're not, we didn't look at non-response. We're not at research house level, and so yeah, there are different ways of looking at that kind of variation, and just that subgroup level is one, and that design effect example illustrated it.
Cool. Okay, then the next question on quotas and the recency of the sort of target population data. Yes, I think that's very true. Obviously, the newer your data that you're targeting, the better. And it was something that we debated quite a lot up front in terms of what to use as our reference surveys, because in some cases there were surveys such as FinScope that were maybe a bit more recent than the DHS survey that we ended up going with across all markets. What we did as well to take this into account is we actually did a split approach. Part of our sample, about 80%, between 60 and 80% of our samples were actually collected using random digit dialing to try and make sure that we weren't, we were trying to get a good spread of people, but then we applied quotas thereafter to make sure those people who are underrepresented based on what we know about the populations from our reference survey were also covered sufficiently in the sampling.
And if I can also just sort of come in on Tara and now also Ingrid's sort of point on the importance of the sort of reference data set. Yeah, I mean, you can already see what's happening with the sort of stats essay surveys that are going to be coming out, that's a concern. And we're talking about shorter timeframes now of quarter to quarter or year to year. But, you can look at a country like DRC that hasn't had a census, I think, since 1984, which was, there've been a couple of civil wars since then, and particularly in the 90s. And so the country looks very different from what their baseline is. And that just, yeah, I mean, I suppose you're kind of shooting in the dark, and anybody who's done research in DRC will have a good sense of just how difficult that is. So that's a really good point. And I think part of our work in terms of trying to engage the statistical agencies, and especially when it comes to let's say non-representative sampling work, is just how important at least getting a recent and sizable and comprehensive baseline reference survey to work for is going to be for doing these sort of relatively cheap ways of collecting the data, but then at least still being able to benchmark it properly like that. That I think is from a lobbying and activism point of view is going to be really important going forward for that to be understood. Yeah, and I guess it goes for the subnational level. If your reference survey is underrepresented at your level of interest, then yeah, then obviously your confidence in terms of what you're talking about, just with the sort of DRC example, if you're dealing with a very small reference subpopulation, your confidence in terms of who you're what you're weighting towards, and actually then how good your sample is, and all your insights from there. That's the same point. It's just at a smaller level. But I see Ingrid's point there, emphasizing Tara's point above. And I think it's, I guess, going again, yeah, a subnational level. I mean, this is why when it comes to reference data, people like to work with census, because you're talking about a massive reference to work against versus maybe dozens of people or a couple of hundred people. And I think Julia and others at GCRO will know just how well and useful the sort of Gauteng quality of life survey is, because of the sampling and the data collection that gets done at ward level, and just sort of how that becomes its own reference survey, akin to sort of a census and another very large household survey that can be used for other things. I mean, I think that probably Julia, Ingrid, and Tara can elaborate further on some of these things, but I think it's just the general point. You really need, when you're doing this kind of work using reference data, you really need massive reference population studies, especially as you go subnational. I don't know if Shirley's got any. I've kind of sort of butted in. I don't know if Shirley's got anything to say.
No. That's you spot on, Bobby. No problem.
All of you. I'm just okay. Go ahead.
Sorry, yeah, just on the last one, I don't really have much experience with power calculations, but what I can sort of say is that I think it sort of talks to the other points from before, that if you're trying to control for the kind of randomization and all kinds of other things that we can see in sort of NIDS, it makes it much more difficult because you're putting those other parameters on. And it's the same with as you go to a much smaller area. But and I guess you've got to take that into account. So I think the more things that you control for, the more complicated your power calculations would get. And that's when it actually comes to data collection management. If you don't control for as many of those things, and you hopefully assume that they work out okay, which is a big fudge, then you'll probably be comfortable with lower power, with lower samples on the power calculations. But obviously, yeah, if you are trying to control for these other sources, the effective samples you'll need to work with are a lot bigger. That's sort of my layperson's sense of answering that question.
Well, thank you, all of you. We've got 3 minutes left, so I'm going to ask you each to just say one brief, pick one thing that you've innovated in this period, and that even going forward, once we can go back to knocking on people's doors, what will you retain? Can we start with Ask Africa?
Thank you so much. Yes, I think the one thing that we will definitely retain from this whole experience is our Agile workflow, and just because we found that we are able to really do a survey in a really quick turnaround time, with the reliability and validity that we aim to achieve. And I also think that the mixed methods approach works really well in instances where there are problems in achieving completes within a specific area. So there is definitely validity in focusing on an alternative approach where you can have a CATI component as part of a large-scale face-to-face household survey, just to also complement that sample. I think especially in areas where it's probably dangerous or difficult to get respondents. I think we all have and know of the difficulties to get into gated communities and also estates. So there are alternatives to that solution.
Thank you. Fenmark.
It's so hard to say, but I think from my point of view, I think actually creating deeper structure in a way to what we've been doing. So we treated our very big multi-country study very much like an ad hoc study, and I think in hindsight I would actually be a lot more structured in how we set it up front, even though it would have meant we went into field later. So I think that would be my key takeout. I think it would have saved us a hell of a lot of time and work if we had been a little bit more structured in our very beginning.
I think just on another point, when it actually comes to the purpose of doing wave by wave indicator reporting to see how things are moving across lockdowns, etc. You can see that those kind of diagnostics on making sure that your sample is as close to your reference population as possible, then makes you, it means that there's sort of less sources of bias in your indicators, and so it's more comparable to actually track what's going on and not say that there's too much noise. So just that kind of sample management and the sort of design effect, looking at things is very useful for the wave on wave tracking, and that's useful.
Thank you. And then the NIDS CRAM team.
Sorry, there was a bit of a breakup there. I think if I had to say from our end, it would really be how collaborative everybody's been, and how important that has been, and all of the support we've received from everybody. It really was a group of people that have come together, and if you needed anything, there was always somebody putting their hand up to help and to solve problems. So from that point of view, I like to maintain the collaboration going forward.
Yeah, and tying in with that, I think that this era of working remotely has shown us just how we don't need to have in-person meetings necessarily, and things like Zoom and Teams are a really great resource, and I found that very helpful for dealing with. I felt really in touch with our service provider and our broader team, so I think I would retain that going forwards. And then the other thing is just to encourage anyone else who is doing something like this is, I mean, it's something we all know, but the importance of a pre-test. And even if you are really, really tight on time, try and do some sort of pilot or pre-test, because there's so much that you can learn from that. And especially with a lot of us doing stuff that we're not used to quite doing, and it is something different. I think there's a lot of value to that.
Wonderful. Thank you, everyone. Julia, last thoughts?
No, just a big thank you to everyone for joining again today. Hopefully we'll look forward to seeing everyone at our next seminar on the 27th of August. We'll be hearing about various community-based research projects and how they've coped with the lockdown period. Thanks again very much to all of our presenters today, and thanks to everyone for attending.
Everyone. Bye.
Thank you. Bye-bye.
Thanks. Bye.
Bye. Thanks.
Cheers.
Thank you. Cheers.